all of us have lived through the pandemic of the last 4 years, and it continues to have reverberating effects down to the present day. The way in which the international system responded to that clearly failed. One of the hallmarks of what happened at the beginning of the pandemic was the retreat to the national. People tried to close their borders, say we're going to deal with this one nation state at a time, one national healthcare system at a time, and it just didn't work. The national was simply not the scale at which the problem could be dealt with. And the only institution we have that's trying to deal with this globally is the World Health Organization. And the World Health Organization actually doesn't answer to the problem, it answers to its member states. It answers to China, to the United States, to Germany, to South Africa, right? And it's the World Health Organization was quite effective at getting the scientists in the different parts of the world to collaborate with one another, but was totally ineffective at getting the national states, which were the fundamental units of action, to be able to coordinate effectively. And that's because the nation state is fundamentally not the unit that's capable of addressing a challenge like a pandemic.
Until we kind of start to build institutions that understand that human health is entirely reliant on and interconnected with the health of the biosphere as a whole, as well as particular species that we interact with, and soil and everything else, we're not going to achieve the level of health that we all deserve. And so this really takes kind of a reconceptualization of the very idea of human health as entirely of a piece with biospheric health and planetary health. We need a complete reconceptualization, rethinking, redesign of institutions in order to deal with the problem the way that we now scientifically understand them.